Thank you. I'd like to start by acknowledging the traditional owners of the land, the Gadigal people of the Eora Nation, and whose land we meet today. So why is it important to gain a workforce perspective on elder abuse? Well, unless we're going to work out a strategy to deal with elder abuse, we've got to bring the workforce with us, particularly that affects residential aged care. I'll just whiz through the first part because I think the Federal Minister for Aged Care spoke a little bit about the statistics this morning. We know that New South Wales has the highest number of residential aged care facilities across Australia. The age of people accommodated is increasing. We know that more people living in aged care facilities now have dementia or require palliation, end of life. When we talk about dementia, we've got to acknowledge that as people are aging, they're not just getting cognitive impairment and dementias, they're also getting physical ill health as well. So the complexity of care in residential aged care facilities is huge. And along with that comes polypharmacy as well. We've got people on multiple medications, and we know that multiple medications in old age don't go well. So what do the latest aged care workforce statistics tell us about the people who are caring for all these ageing people with these complex comorbidities? Well, they're actually telling us that there's lower levels of training in residential aged care than there was in 2012. They're telling us that there's fewer skills in aged care to deal with all these complex comorbidities. And they're obviously telling us now that because of that, there's over-reliance on unlicensed care workers or assistants in nursing. And surprisingly, fewer of those are providing direct care. So we're trying to do more with less in aged care facilities. Just to put a little bit of background as well, these are three graphs depicting the funding that is going into aged care at the moment. And if you can concentrate on the top lines, you'll see that in all three of the ACFI funding domains, there is a high percentage of claims that are for high-level needs across the activities of daily living, behaviour and complex healthcare domains. So there is funding attached to these needs as well. So in order to gain a good picture of what what it looks like out there for aged care workers, we consulted our members who are working directly in aged care, that's registered nurses, enrolled nurses and assistants in nursing, and produced these three reports. I don't know if anybody that wants to just reference these reports, just take a photo of them. They are available on the Nurses and Midwives website to download. So the first one, specifically the Who Will Keep Me Safe, was a survey of over 300 direct aged care workers on the issue of elder abuse and what they perceived elder abuse to look like in aged care and the prevalence. So I'll talk a little bit more about that. The second one was more looking at solutions. This came out around the same time as the Australian Law Reform Commission was doing their investigative work, and we're pleased to say that a lot of the recommendations of their report shadowed the recommendations in our reports too. And the third one's the most recent. We know that there's overuse of antipsychotics in aged care, and we also know that because of the reduction in skills mix in aged care, there's over-reliance on unlicensed care workers handling medications, and that's causing huge problems for our members and also the people that they're caring for. So there's three little scenarios down the bottom. I think anybody that works in aged care or around aged care will know that these aren't far off the mark. There's a need for a much higher level of staff in aged care. It's a specialty area that requires highly trained staff. The middle one's quite shocking. One of my colleagues grabbed a resident so hard it tore his skin off and a hand mark print was on his arm and thigh. I reported it, but the management told me to shut up or I'd lose my job. That's not an isolated comment that we hear. And because of time factors, the last one, time, there isn't enough time to deliver quality care. So the statistics included in these reports, about a third had witnessed resident-on-resident abuse at least once a week. Now, elder abuse was classed as hitting, punching, biting and verbal abuse rather than neglect. So this is actual aggression, verbal or physical, between residents, and that's a shocking statistic when we're thinking about the reporting of incidents of abuse. We heard this morning a little bit about how many incidents that were perceived to be happening. Well, I think this shows that there's a huge amount more that's actually happening. That means that there's at least 200 incidents happening every week in one or another care facility. A third had witnessed abuse either to themselves or residents on every shift. And one of the things that we have to remember about residential aged care is that people can't exit their environment, which makes the impact of the abuse that much stronger. So I had an aged care worker. She'd been employed 2 weeks. She'd been hit in the face by an aggressive resident. She had 2 days off work and had to go back and face that person again. Now, that situation wouldn't happen in the community. Similarly, I was in an aged care facility visiting a lady who was immobile, end-stage dementia and non-communicative. She was in a chair that she couldn't get out of, and the whole time I was there was one member of staff came in. I was there for an hour. One member of staff came in and then left. All the time there was a gentleman circling that lady. I left with her visitor, and he told me he was going back in about an hour. And I said, well, you hear a lot. What's going off? And he said, well, the gentleman that was circling my wife while you were visiting, he can be violent. And I like to visit so that I can protect the people that were there. So that lady in that chair sits there for 24 hours or 12 hours a day, knowing that that gentleman who's circling a chair can be potentially aggressive towards her, and she can't get out of that chair, call for help or exit that environment. So the impact for her day in, day out was really severe. I mean, I think we have to keep this down to the person and the impact of the abuse on them as well. 90% have been subject to aggression from residents, which is totally unacceptable. And the reasons that they gave for that was insufficient numbers of staff, fear of reprisals, inadequate training, insufficient skills mix were the main causal factors. Good care takes good time. If you've got a behaviour management plan in place to manage somebody's aggression, that takes time, and it also takes staff to be present to make sure that that happens. And unfortunately, in a lot of aged care facilities, not saying that they're all like that, but in a lot, there isn't the time to care. So we looked for the workforce to provide us with some solutions. We wanted to make this a positive experience and not just focus on the negatives. So they would like, and I think this has been echoed throughout the conference so far, they'd like some changes in legislation. They'd like some meat behind the quality agency, and they would like there to be much tighter legislation around the reporting of incidents and the management of abuse. Mandated staffing and skills mix goes without saying. Like I say, you can't provide good care unless you've got a good staff cohort in sufficient numbers to provide good care. They'd like a better definition of elder abuse. A lot of our members don't just work in aged care. A lot of people in aged care facilities are actually under 65. So they would like to see federal law that actually defines elder abuse and takes those other people into account as well. Recognition of the link between safe staffing and incidents of abuse. And we again, on that last point, there's very little statistical analysis that happens from residential aged care facilities. There's very little monitoring at state level. Often the issues are referred to Commonwealth. Well, I think we all have a responsibility to look after the people in our state, whether or not these are Commonwealth issues or not. Licensing of unregulated care workers, that's been mooted quite a lot just recently, we know that care workers themselves who are currently unlicensed actually would like some recognition of the work that they do and actually don't feel that this is a bad thing. And enhanced monitoring by the Aged Care Quality Agency, well, they're currently under review themselves, so we'll watch this space and see what happens with them. Thank you.